Hi, my name is Chase, and welcome to the Wellness Center podcast, where we're going to talk all things red light therapy. Thank you so much for tuning into this episode. Please make sure to like and subscribe so you can get updated and notified on all of our newest episodes that we'll be releasing. Have a great rest of your day and enjoy the episode. Hey everyone, welcome back to the channel. Thank you so much for tuning in. This is probably going to post after Christmas, so I hope you guys have had a great holiday season. I hope you've had a lot of fun. It's not Christmas yet when I'm filming it, so I can't say I've had a good Christmas so far, but I did get to go up with my parents over the weekend and do Christmas with them. And it was a lot of fun. It was good to hang out with my brother and his wife and their kids. Yeah, we had a lot of fun. So yeah, enough about me. Let's get right into the study again. Like always, if I'm looking here, it's because I'm looking at my camera. If I'm looking here, it's because I'm looking at my screen. But yeah, we're going to get right into it today. We are going to be talking about strokes. So I've got a lot of information I want to go over today. I'm going to try and do it in a relatively smooth manner, but it's been a minute since I filmed a podcast, so please just give me a break. If you've noticed, I've cleaned up the face a little bit, so if that tells you how much I've changed. So strokes, I am looking at mayoclinic.org. I love coming to Mayo Clinic. I'll make sure to post the link of all of the websites that I use on my on filming for this. So Mayo Clinic, we've got strokes, and I just really want to talk about kind of this section right here. So a stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. That, in very basic terms, is what a stroke is. It's a medical emergency, and treatment is crucial. It can reduce brain damage and other complications. What causes a stroke? So I'm just here on Google of what causes a stroke. It can sometimes be called a brain attack. It happens in one of two ways: a blocked artery or a ruptured artery. So basically blood issues. Yeah. So what can happen once you have a stroke? That's a great question. So I'm looking at the UPMC, Life-Changing Medicine, upmc.com, and we are talking about the days and months after a stroke. So problems that occur after a stroke. So things can be such as weakness, paralysis, problems with the balance or coordination, pain and numbness or burning and tingling sensations, fatigue, inattention to one side of the body, total neglect, unawareness of it, urinary or bowel incontinence. And if you don't know what that means, it means you can't control yourself. You're wet in the bed. You're like a kid again in that aspect. Speech problems, slurred speech, difficulty understanding speech, reading or writing, difficulty swallowing, memory problems, poor attention span, visual problems, depression, anxiety, and mood swings with emotional outbursts, and difficulty recognizing limitations caused by the stroke. So a lot of really serious stuff can happen from a stroke, guys. So now let's look at photobiomodulation and see what it can do for you. So I'm looking from Wiley's online library, a publication that was just recently published. So today's the 20th is when I'm filming it. It was published on the 15th, so 5 days ago. And the article is the effects of transcranial laser photobiomodulation and neuromuscular electrical stimulation in the treatment of post-stroke, dysfunction. Oh, I love this. The article has been accepted for publication and undergone a full peer review, but has not been through the copy editing, typesetting, pagination, and proofreading process, which may lead to differences between the version and the version of record, which is cool. I mean, it's been proofread. That's fine. So the abstract, this is really just, that's the only thing they give us to go off of. So let's look at it. Post-stroke sequelae includes lost function, such as cognitive and sensory motor, which lead to the emotional and social problems, reducing quality of life and well-being. The main aim of our study was to investigate the effects of transcranial, which means on your head, laser photobiomodulation together with neuromuscular electrical stimulation, NMES therapy. Cool. Right off the bat, that tells us something that, again, like we've harped on many, many times, photobiomodulation is an adjunct therapy, meaning you need to do it with something else. So, for example, this study is using NMES, neuromuscular electrical stimulation. If you're doing our weight loss protocol, you should meet with a dietitian and start working out. If you're doing our concussion protocol, meet with a physical therapist and start working with them on concussion recovery, et cetera, et cetera, et cetera. It's an adjunct therapy. You need to do it with something else. We performed a clinical trial and an ex vivo study. For the clinical trial, quadriplegic patients were separated into two groups. So people were separated into two groups. Again, I'm not the best when it comes to reading. It's the whole point of this podcast. It's helping me get better. You guys are along with the journey. Two groups. The first was the treated group, and then there was the placebo group, just to see if there was any difference. Now, how they applied, again, transcranial, so a headpiece. And in that headpiece, there was 12 diode laser beams, so 12 different lights going into their brain. There was only 3 different lights, but there was 12 lights in total. So there was 4 lights at 660 nanometers, 4 lights at 808 nanometers, and 4 lights at 980 nanometers with the average power of 720 milliwatts per cluster applied during 1 minute, leading to 43.2 joules energy per cluster, 15 regions for all the head were irradiated by cluster, leading to 648 joule energy per session. The parameters of the NMES on the paretic limbs to generate extension, wrist and ankle dorsiflexion were symmetrical, biphasic rectangular waveforms, 50 hertz frequency, and a 250 US pulse duration and adjustable intensity to maintain the maximum range of motion. I don't do NMES. That's not my wheelhouse, so I don't know what that means. Our clinical trial showed improvement of cognitive function, pain relief, greater manual dexterity, enhancement of physical and social emotional health, which led to better quality of life and well-being. There's also increased temperature in the treated regions with laser and NMES. For the ex vivo study, which I believe ex vivo means in the body. So there's vivo and vitro, VITRO and VIVO. VIVO, I believe, is in your body, in vitro is like in a tube. The distribution of infrared and red radiation after penetration through the cranium and the hemihead of cadavers were showed. Therefore, transcranial laser photobiomodulation associated with NMES can be an important therapeutic resource for rehabilitation after a stroke. There you have it. Photobiomodulation in conjunction with NMES can be beneficial to help with the recovery of a stroke. Now, of course, if you guys are not in Utah or you're not close enough to get to us here at the Wellness Center, I do always like to go over some at-home remedies that can potentially help you guys out. So this is at everydayhealth.com and alternative therapies for stroke treatment. So first one, acupuncture reduces pain and depression. We say red light therapy is a lot like acupuncture. So it makes sense to me that this is one of the first options. Yoga can help increase your range of motion, the flexibility, the stuff with like the arms and the what's it called? The unawareness of your body and your limbs. Tai Chi, oh, get out of here. Tai Chi helps improve balance. Massage therapy can improve your fine motor skills. And aromatherapy relieves stress, and herbal supplements may improve the neurological function. There you have it, guys. Thank you so much for tuning in today. Please make sure to like and subscribe if you haven't already so you can get up to date on all of the most recent episodes that come out weekly on our channel. Have a great rest of your day. Have a great holiday season, and I'll see you guys on the flip side. Later.